The ones that we don't test can be covered. Yeah, like a lot of laryngeal ones, we don't bother. No. Well, you wouldn't want to be honest. But we'll do the main ones. Don't worry. Yeah. Oh, you know the routine. Yeah. It's quite a relaxing thing to do, to be honest. But there is one last question I need to ask you before we start your cranial nerve exam. Yeah, it's very important. When was the last time that you, as far as you can recall anyway, can you remember exploring an abandoned or haunted location? No, this is a very serious question. Yeah, well, it'll dictate how we start the cranial nerve exam. Yeah. So, when was the last time you visited or explored an abandoned or haunted location? All right. Well, in that case, are you ready to take a look around the olfactory? No, olfactory. Like an old factory, but talking about your schnoz, the sense of smell. Yeah, you really didn't like that, did you? Too much preamble. Too much prelude. Not enough payoff. Well, yeah. Being a doctor, it was only a humorous job back in ancient Greece. Because of all the humor. Alright, anyway. Tough ground. Yeah. And I thought you were the one dying. Okay, that was a bad joke. Sorry. Anyway, we'll get started with the cranial nerve exam. I'm keeping my voice down because I know you've got a bit of a headache and there's a lot of extraneous noise. And I found that actually, when you want to really be heard, when we'll be testing your hearing later, it's better to be quiet. Like you see all the people on their phone shouting. It's not how receivers work. The level of volume that you're speaking into it, that doesn't adjust the gain for the other person, you know, or the volume. If they have it turned down to 0. Alright. Yeah, bedside manner. Bedside bad manners. So, the olfactory, cranial nerve. It's your sense of smell. We don't always test this one, but for that very reason, because it gets looked over so much, we'll give it a go today. It's a very easy test, so I expect you to pass with flying colours. We've got a selection of scents in spray bottles, and all I'm going to do is just spray them in your vicinity like a perfumier at some luxury retail branch in, well, I don't know, Bond Street, let's say. And you're going to tell me what you think it smells like. If you get it right, I type it in and congratulate you. If you get it wrong, I type it in anyway, and I'll still congratulate you because it would be mean otherwise. Alright, so you ready? This is the first one. Give it a little shake up. Get it ready. Active ingredients and all that sort of stuff. So, one on the left, one on the right, one on the left, one on the right, and waft it in. Okay, here we go. Ready? wafted in. Yeah? What do you think? What's that bad boy? Yep, well done. Okay, good job. You started so well. Will you be able to maintain it? This is a cranial nerve examination. Pass, fail, distinction, merit. Next scent, shake it up. Active ingredients and all that. Then one on your right, one on your left, one on your right, one on your left. Okay, here we go. Ready? Okay, waft it in. Yep, bring it in. What is the aroma? Do you like it? No, okay. What do you think it is? Right again. Wow. I can see you visited the Olfactory before. You lied when I asked you about haunted or abandoned locations. Next, this is the penultimate one for our visit downtown to the Olfactory. Shake it up. Big engine cars driving by. Get the active ingredient, all that stuff. And then one on your right, one on your left, one on your right, one on your left. You ready? Okay, good. That's it. Yokata. Wafted in. Perfect. Yeah, I'm not a massive fan of this one. Yeah. Odeur de raccoon. What do you think it is? Perfect. Perfect. Okay. Last one. Oh no, the olfactory's cool, right? You should come down here again. Shake it up. Active ingredient. All that stuff. Alright. Should we switch? No. Keep it consistent. It's helpful to be consistent. One on your right, one on your left, one on your right, one on your left. Ready? This is the best one. That's it. Bask in the flavours presented by the wonderful little spray bottle of scent, perfume of the ages. What do you reckon? Last answer? Yeah? I do a Who Wants to Be a Millionaire's reference, but it's quite tired. Sure you don't want to phone a friend, as long as you don't shut down the receiver. Yeah, good. You did it. Well done. You've completed the olfactory level of this cranial nerve examination to the revenge. No, well done. How are you feeling? Yes. Well, it should be reasonably relaxing. But we have another test. I know. The cranial nerve is a cruel mistress. That's why we have to test their metal, make sure they're pulling their weight. Because if they let down the side, then all hell breaks loose. Now, you see over there? There is an eye chart. Are you familiar with the eye chart over there? Have you seen it before? Is this the eye chart that you recognize? Okay. I don't know why I got my pointer out. you've done this before. We're testing your optic acuity, which is your basically how good your eyesight is. Alright? But what I'm going to do is, first of all, I'm going to cover your left eye, then I'm going to cover your right eye, and then we're going to get the control after, which is both eyes. Alright? So if you can see clear enough, if it's alright with you, I'm going to place my left hand over your right eye, and if you can read the letters as best you can. Alright? So there we go. Just pop that over there. Where'd I go? Where'd I go? So yeah, just if you can, read the top line for me. Okay? And now the next line. Good. Now the next line. Okay. And the line after that. Perfect. And the last one. Okay, no problem. Now we're going to do the same again, but this time my right hand over your left hand. Okay? You see the numbers have changed? That's because it's digital. Pretty cool. Not numbers, letters. Wouldn't want you cheating. Your right eye, your left eye might whisper to your right eye the answers. Kind of that. Alright. Is that okay if I go? Yeah. Now go ahead. Can you see? Sorry. Okay, the top line. Yep. The next line. Yep. The one after that. Yep. The one after that. Yep. Someone's doing some gardening outside. And the one after. Okay. Perfect. Thank you. And finally, they've changed again. But can your eyes, arguably arch rivals, can they work together to do even better than they did on their own? This is the story arc we've been waiting for. Are two eyes better than one? Well, they are for depth perception, obviously. Okay. Go ahead, read the top line, please. Okay, the next one. Next one. Okay. Next. Yeah, as far as you can. Oops, sorry. Hot damn. Another pass. You know, if I didn't know better, I would say that you've done a cranial nerve exam before. Technically, that's cheating, but I'll let you off with the doctor's warning. Alright? And you can tell I'm a doctor because I'm wearing a stethoscope. That's what you get when you graduate from doctor college. Yeah. There's a joke there somewhere, isn't there? But you've had enough of that. I'm sorry. So we're still on your eyes. Okay. Now, someone's gurgling outside. Don't worry about it too much. Is it alright if I get a little bit closer? Because what I'm going to be doing is shining a light into your eye. We're checking your eye movement, your ocular mobility, your, the aperture of your iris and pupil, whatever, things like that. I jumbled that up, but you get the picture. I'm looking at your eyeballs. Alright. So, is it okay? I'm just going to lean in. Sorry, my chair's noisy. I'll just show you. This is how bright the light is. Okay, here it comes. Ready? So it's not too bright. Okay. Is that alright? Is it comfortable? Yeah, just relax. Okay, I'm going to ask you to do some eye exercises afterwards. But for now, yeah, just chill for a moment. And I'm just going to take a look. Right. So if you would be so kind, could you please look up for me? Alright. Perfect. Now look down. Okay. Look to your right, please. Sorry, your left. I'm not very bright. And look to your right. Okay. Please. Look up again. Thank you. Okay. You're right. Look down. Look to your left. Okay. And look to your right. Okay. 2 seconds. Okay. What I'd like you to do, just very quickly, if that's alright, is close your eyes as tight as you can. Yeah, like that. As tight as you can. And I'll tell you when to open them again. Alright? Go on, go ahead. Close your eyes. Okay, great. Okay, and open them. Yeah, perfect. Sorry, banging about on the table. Okay, close them again, please. Okay, now open them. Perfect. Now, how do you feel? So now, I'm going to shine the light directly into your eyes. And I'm just going to check your pupillary response. Okay, so how quickly the aperture dilates and contracts based on how much light is being allowed in. Okay, you're right. It's alright. If you get a bit tired or you want a break, just let me know. Yeah, or we can just stop and do it another day. That's fine too. It's up to you. Okay. Cool. You ready? So first of all, I'm just going to bring it up into your field of vision like this. I won't do the sound effect again, don't worry. And again. I lied, one more time. Okay, and in from your left. And in from your right. And in from your left. It's like a magic trick. And in from your right. Up above. Down below. Too slow. Right. Yeah, okay, so sorry. Just once those motorcycles. Awful. There's a race meet up down the road or something. I don't know. Whatever makes people happy. So if you can stand it, just try to look straight ahead of me. Okay. You can focus on my big nose if you want. That's okay. I'm comfortable with it. Yeah, don't move your eyes. And we're just going to do that again. Okay. And there's the seagulls. Okay. In from your left. In from your right. In from your left. And in from your right. Up above. Sorry, down below. Okay, now I'm going to get in close and then pull away, okay? Like that. Alright, I'm going to do that again. Alright, and the opposite. So coming in like this. It sounds like they're doing grouting outside now. Well, I don't mean to sound ungrateful, but one more time. Alright, cool, fantastic. Last bit. If you could just follow the light. Yeah, keep your head. Yes, keep your head still. Thank you. That's it. How is that? Does it ache at all? Uncomfortable anyway? No, good. hear. That's what I like to hear. You're doing very, very well. Thank you. Yeah, keep following it. Alright. Cool. Cool, man. Alright. Look at my fingers. Oh, sorry. Now I'm going to pull them apart like that. And I want you to tell me when you can't see them anymore. When they both exit your peripheral vision. Alright. Okay. And again. And again. Okay. And again. Alright. Brilliant. So, that's your eyes. We will come back to them because we have to. We have to look at your eyelids specifically in a bit. But for now, forget about your eyes. We're a fashion studio. Yeah, I know. From doctor to director of photography. We're all about face. But not my face. Oh no. No one wants that. Your face. We're going to be looking at, yeah, that's right, facial movement and basically sensitivity of the skin. So what I'd like to do first is just ask you to do some very, very silly faces. Okay? So, yeah, that's perfect. Sorry. Okay. Are you ready? So the first one I would like you to give me a broad smile, like you're actually laughing at my jokes. Perfect. Okay, just hold that for me if you can for a moment. Yeah. Does it ache at all or anything? Just let me know if any of them do. You're doing great, so don't worry. Okay, now show me how you really feel. Frown. Perfect. Yeah. Yeah. A bit too believable for my liking, but we'll let it slide. Okay, now I need you to blow up your cheeks. So like this. Yeah. Yeah. Perfect. Do it again. Yeah, one more time. That last one was just for me, cheeky. I know. Alright, now I want you to clench your jaw like that. Get a nice angle going if you can. And then close your eyes at the same time. So scrunch up your face. Bring your nose up with them. Perfect. You can open your eyes, yeah. Just do me a favour, clench your jaw again really quick for me. Like that. Yeah, bite down. Alright, do me a favour. Sorry. It's just a dipstick. That's me. Open your mouth and I'm just going to pop this, if it's okay, just pop this in between your teeth and then you bite down again. Alright? Yeah, open your mouth up. Okay. Bite down. That's it. Yeah. Don't eat it. Yeah, you done? Yeah, thank you. That's okay. I'll just pop it in the bin. Okay. So now, I'm just going to, if it's okay, palpate your face. You hear that word used a lot. Palpate. It's a nice word. It means touch, really. You know, poke, prod. Do the whole alien autopsy deal. I'm not going to be doing that. I don't know why I said that. So if you wouldn't be so kind, I'm going to ask you to be doing similar faces again, but this time I'm going to just be gently touching the different parts of your face as you do the looks. Okay? Is that alright? Thank you. Are you ready? Okay. Okay, smile for me. Alright. Frown. Okay. Now, blow. That's it. Okay, now, grit your teeth for me. Does that hurt? Alright, apply pressure to your jaw. Do it again, please. Grit your teeth. Thank you. Does that hurt? No? Okay, good. Grit your teeth and close your eyes. Scrunch up your face. That's it. Is that okay? Alright, there goes another bike driving by. Okay. So we need to check your lug holes, or ears, as some people call them. So to do this, by the way, that was all fine. Sorry, I should have reassured you. It was fine. You're all good. Don't worry. Your ears, I'm going to take a look in them with my light, and also so that I can get a good sort of reading on them, I'm going to give them a little wipe out in case there's wax. Is that okay? So again, I'm going to get in a little bit close. I hope that's okay. Yeah? Alright. So actually, if you help me out, I'll look in your right ear first. Yeah? If you just turn to your left ever so slightly. Thank you. Alright. Let's take a look. Okay. Back again. Is it alright? Yeah, if it hurts or anything, just let me know. We can stop. Whoa. Alright, here we go. Okay. Yeah, no, it's fine. No. You do not have dirty ears. Everyone's ears are the same. We produce wax, serotonin, to help protect against infection, and sometimes that can cause it, as I'm sure you have been told many, many times. Just a little bit more. Ah, thank you. Perfect. Okay. Yes, if you just turn to your right, then I'll take a look in lefty here. The old liberal, the liberal here. Alright. Some calls to say, it's Piccadilly Circus around here. Okay. Okay. Yeah. Look back at me. How are you feeling? Yeah. Been down the old ear mine. Hit a vein of wax. Going home now to make some candles. wax it was supposed to be. I should have used the Q-tip. Sorry. My shtick. It doesn't stick. Alright. Could you hear that car? That's a good sign. So, there was a little bit of a wax build-up, which would have interfered with any tests that we would do. But we cleared that out a little bit. Alright. So what I'm going to do now, very simple. That sound. Left, right, left, right, left, right, left, right. We're going to do a little test where I will basically move my hand away from you as I make that sound. And you just need to let me know when you stop hearing the sound. Okay. Are you ready? So we'll start with your left ear. Okay, right. Okay, left again. Right. One more time, left. I shouldn't make other noises. Okay, right. Perfect. All right. Now, what I'm going to do is make a sound. Not that sound. Either to your right and to your left. And you're going to tell me which ear hears it the most. Okay, you ready? It's going to be a little like that, not too loud. Left or right? Okay. Left or right? It's not that funny, mate. Left or right? Keep looking ahead, don't cheat. Yeah. I think you got it. That bloke thought it was funny. That's probably the porter. Yeah, it is. Okay, so, well, I wanted to say, I was going to make a popular joke, but I don't think it's puns aren't, they're not very good anymore, are they? Yeah, so I need to check your swallowing, basically, okay? Yes, so it's to make sure that there are no signs of dysphagia. Now, dysphagia is when you have problems swallowing. It sounds a lot like dysphasia, which in turn is the same as aphasia, which are neurological issues. But dysphagia is, essentially, I was going to say the art of swallowing. Alright, so what I'd like you to do first is give me a little cough. Doesn't have to be real. Perfect. Now swallow for me, please. Like that, yeah. And if there's any discomfort or anything when you swallow. Alright, 2 seconds. I'm just going to put my fingers here on your throat. Is that okay? Mm-hmm. I'll swallow again, please. Yeah. Okay. Now, this will sound weird, but I'm going to ask you to swallow again. And this time, I'm going to place my fingers on your throat, around your larynx, and gently rub, okay? It's to encourage the throat to let you swallow, basically. If you were raised on a farm, you would know that's how you get a horse to take a pill and things like that. Alright? Are you ready? Okay. Okay, and swallow. Yeah, like this. Okay, one more time. Okay, good. Don't worry. It's a new one. Or is it? I would like you, the classic, to open your mouth and say ah. And I'm just going to pop this on your palate, okay? So, say ah. Mm-hmm. Sorry. Do it again for me, would you be so kind? Thank you. Listen, say ah. Okay. Yeah, I know. You can close your mouth. I think those lateral flow tests, the ones where you have to do your tonsils, whatever. Blech. Right. You're doing really well, but can I ask you to do that one more time? I'm sorry. Someone didn't think it was open wide. Okay. Cool. Perfect. Alright. And how's your chewing? What we were talking about. Horses earlier. So can you chew like a cloven animal, a hoofed animal? Yeah. Fully articulate your jaw. Sorry, thank you. So, chew the cud. And the other way. Yeah. Well, no. Did you hear that? If your jaw clicks, it's not usually a problem with your jaw. It's typically a problem with your inner ear, okay? I often suffer from vertigo, which is awful, as you know. It's terrible. Not like the, whoa, I'm on top of a building. The actual, like, oh, shit, I can't. So yeah. So yes, if your jaw clicks, do see a dentist, but more often than not, it's something to do with the inner ear. I'll be checking your reflexes balances in a second, anyway, okay? But, what were we doing? Oh yes, horse impressions. Yeah, no pain. Speaking of, I should have had a look while I was in there. Sorry, can you just stick your tongue out for me? Like that. Well, not like that. Not like a lizard, like I just did. Yeah, properly. Thank you. Yeah, well, the tongues are really good. Sort of early warning signal. It's like the canary of the mouth. It's like your lymph nodes as well. Are really good indicators of whether or not you've got an infection. If they're inflamed, if your tongue looks gross, something ain't right. So yeah, if you're feeling rubbish and your tongue looks rubbish, go to a doctor. If your tongue looks rubbish, probably go to a dentist first. If your lymph nodes are swollen, try taking some anti-inflammatories, and if that doesn't help, then definitely consult your GP or come and see me. All right? Oh, I said that really quickly. Sorry. Righto then, let's move on, shall we? What I'd like you to do now is look at me and act as if you don't care. What's he saying? You ask me. Now what I'd like you to do is shrug. So yeah, bring your shoulders up. Yeah, as high as you can, please. Alright. Yeah, hold it there for me, please, if you can. Yeah, I'll count down. Yeah, sure. Bring it up. 5, 4, 3, Can you do it again? But this time, don't bring your head forward, if you can. Okay, try to keep it up straight. Look at me, straight at me. Yeah, sorry. And bring them up. Bring them up. See, we're both doing it. We're like Groucho Marx. All right, then again. 5, 4, 3, 2, 1. Not very flattering, but informative. It's time. It's time. Avengers, assemble. It is time for... It's not reflexology, it's reflexes, okay? So what I'm going to do, you sat comfortably. Okay, good. What I'm going to ask you to do, we're going to do your arms first. So I'm going to ask you to place each of your arms in my hands, and I'm going to tap it ever so lightly, just to see you go, whoa, whoa, whoa. It shouldn't be that extreme. Okay. So please, if you would be so kind, place your left arm, your left forearm in my right hand. Here. Thank you. And I'll give it a little tap. You ready? I'll give them 3. 1, 2, 3. Is that okay? And again. Excuse me. Okay, and again. Okay, same again, but with the right arm. Place it in my left hand. I'll hold on to it, don't worry. I'll give it back to you after. Thank you. You ready? 3 taps, 3. Yep. Okay. And again. Okay, one more time. 2, 3. Perfect. And now your left leg. I'm just going to hold it with my left hand. That's it. Okay. Don't worry. Sorry. I was okay. I'll tap it 3 3s. Okay. Ready? 1, 2. And again. And again. Perfect, thank you. Yes, so hold your right leg, my left hand. Hello. And I'll do 3 3s again. Alright. Okay, you ready? Thank you. 1, 2, 3. All good. One more time. Perfect. Okay. Oops. How are you feeling? The getaway car's here. I'm honestly sorry about all the noise and my leather seat. But was that all okay for you? Yeah. Oh, my hands are sweaty. Yes, but yeah, there was no great amount of pain at any certain point or anything like that. No. Okay. Yeah. From my perspective, perfect. Yeah. That sounds over complimentary. You are perfect. I mean, you are, of course, but what I mean is that everything seems tippity top. All fine. Dandy. Yeah. The only thing I would say is that maybe just give your cleans, give your ears a clean every now and again, but don't be too aggressive or abrasive with it. Yeah, don't really. I mean, really don't clean the sort of the external part, the extraneous region of the ear, all the bits and bobs, and there's a plane coming. How are you getting home? Good grief. Otherwise, it's always at the end of an appointment. I mean, always at the end of an appointment. Listen. I'm beginning to think, are you like the premier of a country or something? So much so that towards the end of any medical appointment, a private jet, or what sounds like a 1911 biplane, comes and picks you up and takes you back to your palace. No, alright, fair enough. No, you never know. Yeah, so basically your eyesight's great, so if you fancy it, go for a checkup at an optician's or what have you, but no need immediately. And yeah, as for your ears, if you just give them an external sort of very topical wipe, don't stick a Q-tip in or anything. They're more trouble than they're worth sometimes. Or if you've got, a very good friend who'd be willing to have a look in there for you, then maybe that's a good idea. But otherwise, yeah, all good, fantastic. And yeah, I'm sorry, it's such a system shock, these planes all the time. I'm sorry, I do apologise for them. But anyway, I hope that your appointment was relaxing, because that's what the cranial nerve exam is all about, isn't it? But it is always wonderful to see you, and I'm really glad to see you looking so well and so cheerful, even if you didn't laugh at all of my jokes. But I'll try writing some new material, and the next time we have an appointment, you can be my test audience. All right. Cool. Yeah. Ooh, absolutely. Yes. Well, no, please, just as usual. Here's your prescription. Take care, and don't do anything I wouldn't do, but do whatever you want within reason. Not that I wouldn't want to do, but that I would do. That kind of. You take care. All right, thank you. Bye.